Good evening, everyone.
Recording in progress.
It's recording now. Hold on. Good evening, everyone. I'd like to call the August 20th of the Board of Health meeting for the town of Ashland to order. The first thing on the agenda is citizen participation. Any citizen participation? Mark, go ahead.
Yes, good evening, everybody. Excuse me. Board of Health, listen, in about 3 or 4 months, I know it's way early for this question, but I'm going to ask it anyways. Is there any warrant articles that's going to be for the town meeting coming up that's in the works?
I don't know of anything. Raj, do you know of anything coming up for a town meeting?
I mean, to my understanding is that they are planning, so it should be out soon, but there's definitely planning about the town meeting, at the town hall.
Does our updated tobacco regulations have to go there or no?
No, sir.
Okay.
That
That
that's
doesn't
just
require
a
town meeting regulation.
Okay. That's it. Thank you.
You're welcome, Mark. So the next thing on the agenda is Townhouse Pizza, cease and desist operations, unpermitted construction. Do we have anybody from Townhouse Pizza here on the meeting?
Yes.
Okay, we do. Raj, do you want to start then?
Thanks, Mr. Chair. So what happened? This was on August 8th, right? The plumbing inspector was in the plaza that he saw some work going on at Townhouse Pizza. So he called the building commissioner that he went by and saw what they have done is they have removed all the equipment. They were doing some flooring, but it was unpermitted, they disconnected gas lines and all that. And he called me on spot when I went there. Yes, I saw some food in the restaurant, but the other thing was there was a lot of food in the next door space, that it's called Salt Waters. It was a nail salon that they was storing. Earlier we had conversations, about storing just dry boxes or something, but there was a lot of food. So and they have anyways closed the operations, for the renovation. So it was more building department stuff, they was doing everything without permit, so.
All right. Do you want to introduce yourselves and kind of give us a history of what's happening there?
Go ahead.
Go ahead.
Okay, so I'm Natalie. This is Andreas. My father, he's the owner. So as we knew for the flooring, like we didn't know that we need a permit for the flooring, right? But as for next door for the storage, we already did as we asked for the testing, right? If the whole place is okay and safe to storage any kind of like dry food is, and just keep some refrigerators there, right? We already sent over the report that it is safe to keep dry food and that stuff. And like that's it. We didn't know before that we have to do something more specific, like the testing that we asked for right now, right? And as for the floor, we had to change it because it was there all the years that the building is there, and there was like issues with the floor. There was water coming, it wasn't good to be as it was. So we had to change it.
Okay. So I have a couple of questions. So how long have you owned the business?
5 years.
5 years. So, as you know, the town itself is very approachable, especially for their business owners.
Sure.
I hope in the future, if you have any concerns, you'll reach out to Raj if it's a Board of Health issue. If you're going to make any changes to the structure of the building, gas lines, water lines, all of that does require a permit.
For the flooring as well?
Well, no, but what we were told is that when the building inspector went in there was a lot more work being done than just the flooring.
Okay.
There were gas lines removed, things like that do require a permit.
All right. Yeah, I'm sorry about that. We didn't know about that specific permit, but now everything is going by the process that Board of Health asked us. We have all the permits, all the papers done. And just a last question that I have for the next door with the storage that we use. They need the specifications of the refrigerators by an email or by paper, or it doesn't matter how it's gonna be.
Either is fine. You can email it to me, whatever is convenient to you,
All right.
So
Okay.
what we are looking that this equipment that you have there that is certified and commercial,
Okay.
so
Yes. Yes.
so you understand now. I know you dropped a couple of emails today. So if you
Yes.
look on the side of the equipment, even it'll tell you where to go, and you can Google it and pull out the specification sheets.
I find it out. That's why I'm asking, because by an email, it's gonna be, faster to send it over to you.
Either is fine. And
Okay.
Mr. Chair and the board, just to let you know, they did get the testing for the VOCs done, for the nails loan part. The result have come out good. So only thing we're gonna need is the specification sheets. If the equipment is good, I guess if board allows, we'll be able to, grant them permission to store stuff at least in that space. I mean, they definitely won't be able to prep it, but if we have to start doing other stuff, we need more information about light and all that, stuff. But that's for right now. We can give them permission once they submit the pending paperwork that they can start using that space for storage.
So when do you plan to reopen?
When do we plan?
Or are you already reopened?
No, we are not. We are getting down the floor, and then we will arrange an appointment with Board of Health so they can do the rest of the inspections. And if everything is as it has to be, they will tell us if we can open and when. But for the next door, it's going to be only storage, no preparations there or something else. It's just the fridges that I put on the floor plan that I already gave, and that's it.
Okay, that sounds good. Do any other board members have any questions?
We are all set.
No, hang on. I just want to see if anybody else from the board has any questions.
I'm sorry.
Until they've opened, they're not cooking anything there, and nothing is being served, I presume. Is that right?
Yes,
they're
we are
closed.
not cooking anything there. Yep.
Okay.
Yep.
All right. I'm fine
All
with
right.
it.
All right.
Yeah,
Well, thank you for joining us tonight and clarifying everything.
Thank you so much.
And again, just any questions, please reach out to Raj directly.
Yes,
That'd
sure.
be great. Great.
Raj,
Thank you very much.
I'm sorry
You-
about that. We didn't do
That's
it
all right.
earlier.
Raj, you don't need
Absolutely
our specific permission for doing whatever that needs to be done when they're straightened out.
No, sir. No, that's
Okay,
good.
that's
Thank
fine.
you. Thank you.
Great. Thank you for joining us.
Thank you. Thank you. Have a good night.
Thank you.
All right. Okay, the next thing on the agenda is that Happiness Garden Technology. Do we have anybody there for that? Anybody here?
Yeah.
Oh, Raj, do you want to start us off or?
Yes, Mr. Chair. So we have Mr. Annie, who gave us a demo a couple of weeks back, maybe it's a month now, Mr. KG reach out, they are doing some technology stuff that they have offered it to Board of Health and the town that they can provide some services free to the town, so they would like to present that,
Okay, go ahead.
So thank you very much, Board of Health members. I really appreciate inviting us. So as we all know, a happy community is a healthy community, and happiness has to be practiced daily for it to happen. My presentation is about the Happiness Garden. It is a novel, natural, easy way to practice and spread happiness. It has been built on the principles of positive psychology with the guidance of our esteemed board of scientific advisors. Amongst our advisors present today is Dr. Kathleen Palm Reed, and she's Associate Professor of Psychology at Clark University, and Dr. Kaushal Nanavati. He's an integrative family medicine practitioner and Associate Professor at Upstate University Medical School. Dr. Soumya Chaturvedi, who is a neuroscientist, has not been able to attend today. Oh, she has just recently joined. Hello, Soumya, Dr. Soumya. I'm sorry, it's so nice of you to join. So basically, we really have a strong basis and foundation, which is a scientific basis. We are not scientists, but we are application engineers. And we think that this application could be very useful for the Board of Health. Divija Nanavati is my co-founder, and I'm Ani Chitale. The public version of the garden is free and anonymous. No ID is required. We are happy to provide and maintain a customized version for the health department, free of charge, as our contribution to the town of Ashland. There are no external advertisements allowed, and no external marketing will be allowed in the customized version. We believe that the Happiness Garden will help build better wellness and togetherness in the community. It will also allow health department to post or publish health impacting images and videos, and even have health quizzes, etc., to keep the community connected, engaged with the town and with each other. Now, with this basic background, I'll go straight into the demo of the Happiness Garden. And of course, we are open for all kinds of questions. So can I share screen, please? Am I allowed to share screen?
Yes, you are already a co-host. Please go ahead. Thank you.
So I'm going to open the Happiness Garden now. And generally, the QR code takes people directly to the Happiness Garden without having to do anything further. So when the first time the Happiness Garden opens, as I'll explain later on in the back end, we have currently arranged that some sort of a video clip shows up to garner interest of the folks who are entering the garden. Once people enter, they can enter their own thoughts, positive thoughts, affirmations, happy messages in any of the white flowers. As you see, we opened the garden. We have not yet advertised it. This is the public version. Opened it on the 1st of April, well, actually 31st of March. We didn't want to call it April Fool. So we opened it on the 31st March. So just within a few months, without any publicity, the garden word of mouth is getting full. And you can see all the colorful flowers are the messages people have entered in the past or are currently entering. And if we want to enter a message ourselves, you can very easily go into any of the white flowers and we can enter a message here. So I could say here, hello, everyone. And if I enter this message, so message not valid because I enter slash and 1, but now it will say, okay, save. So the message got saved and it came about, and it can come later or it come right away. So basically this is the interaction. Essentially it's a crowd gatherer. The technology is device independent and it can be displayed anywhere. So basically people will see the garden in the front ends, either on their devices, phones, PCs, everywhere, or on a large display panel if the Board of Health wants to install any display panel everywhere, because it's device independent. And also it is interactive. People can keep interacting with it by the, let's say after X number of months, if the board wants to download all the messages that people have entered to see what's the general feeling in the community, then the board has a facility to do it. So right now, I'm just focusing on the front end. If you folks have any questions, please feel free. If they are of a scientific nature, then our board of scientific advisors will answer those questions.
I have a question. Can this be used to focus on a particular target audience? Like, for example, like if this is something our schools would be interested in, could they have it just geared toward like a middle schooler instead of having it like the whole general public stuff?
Yes. So what we do, Ed, is when we customize it, you see the top here, this URL. This URL is public. When it's customized, there'll be a slash, a particular custom version for a particular group of folks or corporation. So since this, we are giving it totally free to the town and as a public service, we do it so that, let's say the school says, okay, we want it only for the elementary school, middle school, whatever, then we will customize it just for them. So their appointed individual will have access to the back end, so to control everything in the front end. Also, what happens is when that happens, only the entry, right now the entry being to the public, there is no way to manage control. Anyone in the world can enter. In that case, the entry is controlled, and only X number of students within the 2 days who actually enter the garden, they are automatically assigned usernames, but it's all anonymous. So there is no identity of a particular student or faculty connected, so nobody will know who is putting the messages. But at the same time, the ID, the username is maintained. So yes, that system, and we can demo that also to you folks at a later date outside this meeting. And for any different audience also, let's say if the board wants or the town wants for some different purposes, the same kind of technology could be applicable for either getting some kind of feedback from a particular community about some topics. Then you have to keep that customized garden open for only X number of days. And when that feedback comes, after the feedback, then all these flowers will be back again to the original state, which is what you want for either promoting happiness or wellness. Did I answer your question, please?
Yes, yes. Does anybody else have any other questions?
I do.
KG?
Hi, thanks very much for the
Hi.
presentation. I'm curious, this is, I'm sure, by subscription to folks that you're not giving it away to. How much business are you getting, or how much traffic, and what are the fees usually?
We don't charge anything to nonprofits and to charitable organizations and to towns public service.
And what about to individuals?
The individual subscribers, what we are doing right now is by design. So, this is a venture we started 3 years back, and this product is one of our latest tools. And we have decided by policy and design that this tool for some time is going to be free to everyone except corporations. And right now, the corporation, before giving to the corporations, because our target is very obvious that to be sustainable, we have to approach people like Microsoft and Google, who don't have this technology. By the way, we have applied, we are registered in Ashland, and we have applied for a patent. It's $50,000 a pop to get a patent, but we have pretty strong conviction that we will get the patents because we have checked out that Apple, Google, and all these folks do not have the specific technology that goes behind. This front end looks very easy. The back end is pretty complex to run on a cloud and international. So that's our target. But before we go there, currently by next week, actually, Dr. Kaushal will explain that. Dr. Kaushal, if you don't mind, explain about the Nurses Association, who are going to be actually using the garden and some other apps that we have developed for almost 5,000 folks, people in upstate New York. So
I'm Kaushal Ganavati, SUNY Upstate Medical University in Syracuse, New York. And so what we're going to actually do is make this accessible to all of our nurses, along with the app-based technology that goes with it, so that they can access this. The intent is that through screens within our institution, consistent with that middle school question, it'll be a healthcare environment that's going to be able to utilize this to proactively support positive messaging and positive feedback, and then promoting positive health-oriented behaviors as well. So at this time, we're gaining the volume of users so that not only does this get populated more, but then it's an opportunity to also connect in specific target populations with health promoting messages. And that's all going to be something that is freely accessible to all of our staff within the institution. There's over 11,000 employees and over 5,000 nurses who are going to be able to access this.
And Dr. Kathleen Palm Reed, she, in addition to teaching psychology at Clark University, she's also heavily involved in the wellness program at Clark University. So, Dr. Kathleen, could you please mention a little something about what you are trying to work out with at Clark University, please?
Sure. We're working with the provost for student affairs at Clark to bring a Clarkified version of this. I'd like to talk about. I can imagine there'd be an Ashland or an Ashland Middle School version. Just bringing community and kind of positive messaging. I think this is a great tool to be used, especially I've been talking to her about using it in the residence halls at Clark. A lot of students are feeling isolated still after a period of time with COVID, and this is a way to be focused on some positive messaging and kind of encouraging them to be engaging in active behaviors that are oriented toward positive thinking and kindness to others. So we're in talks with the provost right now about launching something like this at Clark.
If there are no, yes, please.
Yeah, I addressed to Dr. Kathleen Hipcom here. Is that true that once you share happiness messages and kind messages, this spreads around and increases the health of the community itself? Is that true?
Happiness tends to spread. So there's definitely been a lot of research on gratitude interventions, online gratitude interventions, and it's been shown to increase people's reports of well-being and increase mood, and even have some effects on their physical health. There's also been research supporting the amount of kind of civic engagement, so which kind of like has another like evolving effect on it, because the more they're engaging with the community and each other, then that also has positive effects. So it can really it might seem like a small thing, but it really can kind of start to kind of build on itself and have this much larger impact.
Thank you.
Sure.
Dr. Chaturvedi, Dr. Soumya Chaturvedi, you were mentioning me about some research about how when happiness and other good information is shared with others, and if it's recognized, you are mentioning that certain sort of hormones get generated in the brain. Could you please elaborate a little on that? Hello?
Can you hear me now?
Yeah.
Okay, so a lot of research in this field happened that the happiness is mainly happen because of two factors, like endogenous factors, like which are related to biological and your genetic factors, and some like exogenic factors like social, cultural, behavior factors, and so on, like cognitive factors. So if those factors are very important, and those factors are very important to release those neurotransmitters and like dopamine or serotonin, those kind of factors which are responsible to control the happiness. So overall, I feel like for the Ashland School or for nurses, those factors, if you have those feeling, like it can help you overall health, focus, and it can improve your overall focus and health. So those, because in general, a lot of things are happening around you, is I feel like a lot of negative things going on. But if you will consistently seeing those positive messages, and you are releasing those neurotransmitters like oxytocin, which you sometime you can those factors are released during the exercise, during doing any positive things. So those factors are very important for your health.
Thank you.
Thank you, Dr. Soumya. With the feedback obtained from our advisors by now, and the psychiatrist who was not able to attend today, what we have done is, in the next version of the public version, you're all quickly going to see that if we like some message, then we can show like a heart or a thumbs up. Only thumbs up, no thumbs down. And so what happens is, like, I'm entering messages, and if I see a whole bunch of hearts or thumbs up, that likes of other people, then according to what the scientists have told us, that then I will feel much good about myself. So that's an important factor when I share something with others, because I'm getting rewarded. Oh yeah, I'm being appreciated for whatever my message is. So we are quickly adding that facility, just FYI. If you folks don't mind, and I respect your time very much, so can I go to the back end of this front end now, where all the magic happens?
Can I ask a quick question before you get into that? Just as we're talking about this, so that makes sense. You see some of these messages, it's changing the brain, changing transmitters that are involved in happiness and mood or emotion. Has work been done specifically with this tool, these shapes, these colors, these messages? Or is that part of the plan? Where does research stand with this in particular, I guess, is the question.
I guess Raj Gupta might have better answers for that, because we have not yet approached any school per se, although we have approached the Tiverton School District superintendent, where we had shown a demo of this before the school ended last year. And now they are very interested. He invited principals of the elementary school, middle school, and high school who saw this demo, and immediate reaction was, yeah, how can we implement it? And now the details have to be worked out for each of the different schools in the school district. So we are hoping that when the new school year begins and everyone is back at work, we'll have an opportunity to start working in customization, because each of the principals wanted a little bit of different customization for their own needs. And so maybe I've not really answered your question, but I really don't have a full answer.
I mean, this is a new technology that has come up just now in 3 or 4 years. So nothing has been put to test in terms of doing research, but in general, you say that happy messages spread happy things, keep the community happy, because there is potentially other sources of evidences which medical journals have published, I presume. Is that right?
Yes.
Yeah, no, and I'll also answer Jay's question directly. I think, first of all, it's a great question. So fundamentally, as we get more user bases in different subpopulations, the data gathering that'll come from feedback is going to be the way that we'll be able to get more information. 1, on utilization, 2, on value, 3, you talk about the colors. if you look at the colors on the screen specifically, with the yellow and green especially, in terms of being more brighter colors, etc. Red, it relates to several different emotions as well. So there has been some background work done with the colors historically. With this app specifically, we'll get more data as people start to use it more as well, especially if we realize that all the green and yellow flowers are gone, but none of the red are. Well, that's going to give us data as well. So there's a multitude of directions we can go in. But fundamentally, it's that user base and access that's important. You notice we didn't put gray and black flowers on there, right? So we've done some fundamental background work on why the colors are what they are, and then we'll get more data as users utilize it as well.
And I would add one thing here. As we all know that in normal clinical trials, we have like one treatment assignment and one is placebo. So sometime in especially in psychiatry and CNS disease, mental disorder clinical trials, what happens that subject just patients, if they feel like they are getting medication, they feel like they are getting better. So I mean, it's just a placebo effect. If you are seeing happiness, you are feeling that, oh, you are getting good messages, and that thumbs up we are going to add in this app, you feel that, yeah, you are giving something and somebody is feeling better just doing some kindness. That placebo effect, that you are doing something good and you feel good, so overall health will improve just because of this placebo effect. So
Right.
so that research is
that makes sense. It's impossible to separate the placebo effect with pretty much anything, and especially something like this. But if that is the effect, then that is the effect, and that's good.
Yeah.
So
You're
okay,
right.
thank you.
One question as you move on with your presentation and talk about the back end, will you talk about content moderation for the platform as well? Okay.
There is, and I'm going to show that to you. One moderation we have done is, as an absolute rule, is no foul language and no violent language. And that was the starting point, because the whole thing is being anonymous, and it is originally developed for worldwide platform. We had to be extremely cautious. Of course, it's limited to English, but right now. But so what we had to do was collect a dictionary of foul words. I share that with you quickly. And that came from, you will not believe, from Facebook, Google, Apple, and one more source I'm forgetting now. For developers, they provide this foul words dictionary. They themselves do not stop people from exchanging all these foul words and all on their systems, because they lose money in advertisement, but they do have that capacity. So we were able to get that. We combine everything, and we have our own foul words dictionary. Along with that, attached is the AWS machine learning. So what happens is that if new words start coming, then human beings say, hey, out of all this foul words exhaustive dictionary, still something slipped, even though the word itself, if you go to any dictionary, doesn't seem to be like foul or violent, but the combination might feel. So the human being tags it, and now the machine learns. So this is an ongoing process. Up till now, I show you only a few foul words were detected in up till now usage. So can I share that with you, please, now? So that is the moderation, but beyond that, if the administrator wants to moderate further, they can in the customized versions. In the public version, the only moderation is this foul words. So now here's the so basically all the messages that are entered, you will see in the garden, they have come here in this list here. So up till now, now see here says, hello everyone, it's pending. If you notice, when I entered that message, I, as the person
Ani, we don't see that message here, I think.
Oh.
In the other screen, the previous one is still on.
Oh.
So you need to switch it to the.
My screen is updated.
Yeah, mine
good.
is too. It might be
Okay.
you,
I
KG.
stopped sharing and reshare. So maybe.
Okay.
Can you see it better now?
I only see a manage garden.
Yeah,
Okay,
manage
that's
garden.
fine. Okay, that's fine. Thank you.
This is the admin panel.
Okay.
And this admin panel is the dashboard. It has many other features and functions for administration, because Garden is only one of the tools. We got many other apps which are mobile apps and all. They can all be controlled in many different ways. So the focus right now is on the admin panel. So you'll see what we have done purposefully, because it is public garden. We have said auto approval is off. If auto approval is enabled, then even before anything else happens, everyone will see the message I entered. You saw that the message I entered was visible to you because it was visible on my screen. But if you had opened the garden, you will not get it until this says pending. So the admin, what we do generally, and by once a day or twice a day, we go over here. And if the message is kosher, we just say approve. And then we enter and update. When we do this, this message is now seen by everyone who is visiting the garden, not just me. The other check here is if you enable it, which means automatically the message is approved, provided the bad words are not existing. What it happens is there is a bad words dictionary. You will see this. See, all these are bad words that we have collected up till now, and there are almost 2,631 bad words. And all kinds we have tried many different words and combinations. So if anything like this comes up, the system automatically rejects it and tells the person entering, hey, this is a foul word, change the language. It's objectionable word. So that's one check we have. Then up till now, what has happened, how many bad words have been used up till now? You will see the bad words used up till now are grand total of up to 10. No, up to 40 bad words have been used. And all these things you can see, you can read them. So they were not caught by the system. So now once they were not caught used, we automatically added them. Now these words, once added, people keep using them, the administrator has a way to revoke access to the garden for that individual user. So right now, this is a username. If we want that, we can revoke the garden. So we don't know who the person is. But what has happened is we found out that the person didn't use it. Maybe the person was just toying around, trying to test the system or something. So that's the explanation. And what we do is once the bad words are to be added, they get added, and then there is a rejection code here. So we apply, there are many rejection codes. So the human being says, okay, this rejection code has to be applied for a particular message. So bad language and word, whatever that is. So if you see here, we can give a message code, and that code is remembered by the machine learning element here. She says bad language word code S7. So this code, the machine learning module remembers that for a particular combination here, that whatever the combination of words was, is now next time that combination comes up, the machine will say, okay, it's basically AI. I'm not wanting to call it AI because I'm from my technology standpoint, AI is just a buzzword. you have to teach the robot a long time. Whatever you teach the robot, remember, the robot is not creative as yet. So that's why I call it just machine learning. So that's the now another feature for the happiness garden is if we want to show, if let's say the Board of Health wants to push messages in the front for education or whatever purpose. First of all, simple messages like greetings. You will see that this greeting message will come every time, morning, afternoon, evening, when somebody is entered the garden. Everybody gets this thing. So this message is pumped by the administrator. They can change the message and they can say what times, morning, afternoon, evening. So there's a setting there. You can go here and change it. So that's one facility. The other message is incentive messages. We have not inserted any, but people can insert any kind of messages. Hey, you know, competitions that come here, and if you're going to, if 20 people attend here this particular event for health or something, whatever it is, then we'll give them some recognition. So incentives are possible. The most important is the discount. We call them discount banners, but for you folks, the name could be, you know, not meaningful, but there are different types of discount banners, and you can add a discount banner. So let's see if I add a discount banner, a new one. That is something to be pumped in the front. See the power of this. You give a title, there are many triggers for it. In this case, let's say we are talking about the garden, there are about 10 or 11 triggers. The trigger means different reasons. See, HG is the garden, happiness garden. Somebody clicks on the own messages button. If they click, they see a message. Only those people. Somebody clicks on download PDF because there's a facility in the front end, their own PDF, then they'll see the message. So basically, this is the way it will operate. Yes, Raj, you raised your
Mr.
hand.
Annie, yes, sorry to interrupt. You know, a couple board member have a next meeting. So what we'll do, we'll continue the conversation. I'm sorry about that,
Yes,
you know, but
no, absolutely.
given the time constraints, you
No,
know.
absolutely. But I hope I try to explain the power of the back end, which
No,
can be used by you folks later.
absolutely, and we'll continue this conversation, you know, with the board.
Yeah.
Thank you. Yeah.
Thank you.
Yeah, thank you for joining us tonight. This is very informative, and the board will speak with Raj about how we can maybe help this with the schools and things like that.
Thank you very much. Thanks, Ed.
Thanks.
Thank you for your time.
Thank
Thank you,
Dr.
everybody.
And
Thank
thank you, Jay. And then thank you, our advisors. Thank you very much. Appreciate your help.
Thank you, everybody, you know.
Yeah. Bye now.
I could
Bye.
definitely see this maybe being like up on a big screen at the middle school, things like that.
Yeah. Thank you.
Yeah.
Bye now.
Bye.
Bye-bye.
Bye.
All right, that was interesting. I could definitely see where that could be used possibly. All right, health director's report. Raj, you're up.
Mr. Berman, it's Dr. J first, you know. Sorry.
Oh, hello. For some reason, I can't find my version of the agenda because of the view I have here. I'll deal with that later. So anyway,
Congratulations, Jay, for a successful.
excuse me? Oh,
Congratulations for a successful event.
well, thank you very much on behalf of everybody that was involved. Yeah, it was really good. I've got some statistics here to share, and I'll send these to Raj and to Laura, so you don't have to copy all this down. But yeah, it was really good. It was busier than it was last year. I think it ran a lot more smoothly than it did last year, which isn't surprising. The CHG and the everybody involved just did an excellent job. So I'll give you some numbers. We saw we registered 376 what they call unique patients, 319 adults and 57 children. There's a proportion of those that probably left the parking lot, about 10 of them. So 366 of those folks were seen in our clinic for a total of 532 different services, because you can get 2 services in one day. You can have dental or vision plus medical. So when you combine all the services that individual patients got, you're talking about 532. We provided 183 patients with dental service, 156 patients with vision services. That includes 158 pairs of glasses. 193 medical patients received exams, women's health, related labs. 57 patients were identified for follow-up care, and the Latino Health Insurance Program in Framingham is doing that for us, which is great. The total value of all of that, from a Medicare perspective, if you were to monetize that, is $211,633. We had 293 volunteers over the course of the 3 days. So one setup day on Friday and then two clinic days. So 293 volunteers monetizing their volunteer time, or what they call service value. It comes to $135,360. So, just doing this math in my head, it's close to, what do we have here? $450,000 worth of care, I guess you could say. So yeah, it was pretty successful. Ed, do you have anything to add? I feel like I got the easy part because I have the numbers.
Kim and I didn't have a fight this year, so we're good.
Well, that's good. Yeah, it was excellent. And Raj, we appreciate all the help from the board and everybody's support. Just as we had it last year. Everybody was really supportive, and very much appreciate that. And I know Barbara's not here, but she was there for at least one of the days, if not two. I can't remember. So
no, she was there both days.
She was there both days.
Okay, yeah. So yeah, very good.
Unfortunately, I couldn't join you people because of my condition.
No, that's okay. And Dave was sick, so we totally get it. Not a problem at all. So
yeah, I'm sorry I couldn't be there. I'm glad it all worked out though.
It did.
Congratulations, Jay.
Thank you, Laura. Thanks very much.
Was there any sense, Jay, about, I don't know if they collect numbers on exactly from where or what communities the people that end up getting served are?
Yeah, and I'm still trying to sift through those numbers. The ones I just gave you are really right off the press. I got them about 2 o'clock today. But yeah, we have all those numbers in spreadsheet form. So I'm gonna try to pull together some additional information. I mean, last year it was the large majority of the folks were from Framingham. And I assume that is the case for this recent clinic. So, but I'll share those. Any other questions? I know we're a little behind today, so I don't want to take up too much time.
All right, Raj, you're up.
Yes, sir. Thank you. So first, the Dean Road, 27 Dean Road. I know it was in front of the board last time, right? And then the engineer didn't show up. So we're still working through it. I connected Mr. Paul Sonier, who's from the Colonial Engineer, with the Eversource, right? And they asked him documentation. This was 11 days back, and he have still not provided it. Yesterday, he emailed me back again that he have not heard back from Eversource, but he have not responded to their last email. So we're just still juggling with it. I did get a couple of emails from him stating that he's going to build the system and stuff like that, but still working through that. Coming up on August 28th, we have our International Overdose Awareness Day. We are celebrating that. We are doing that event at our safety building. We're gonna have a table from Board of Health side. It's in the evening from 5:30 to 7. If any board members want to join me, and our public health nurse is going to be there. And I guess I talked to Dr. J, who did it last year. So Dr. J or any board member, if you want to join, please. It's at the public safety building this year. And Mr. Kingsman still working on the tobacco regulation application. Once I have it, I'll send it to you for review. And still last couple of weeks been busy. Coming to the arbovirus report. So right now, within the state, we have 2 positive West Nile cases. One was in Hampden County, and then other one was in Middlesex County. That's ours. Then we have a AAA case that we saw last week in Worcester area. So the threat been there, but at the same time, I just want to update board a situation I was in today. I don't know if this is the right forum, but I feel I should bring it to board's attention. So I we had a abandoned pool and very overgrown garden that we had complained almost a month and a half back from here at 11 Pine Hill Road. So I reached out to the owner by phone. Laura found it from internet that he did hang up on me when I was speaking with him. Couple of weeks later, we did send him an order to correct letter. This was this morning around 9 a.m. I was at the property. The property was vacant for some time, but there was a car this morning that I went and I knocked on the door. There was a gentleman who was the owner. I told him like, hey, good thing to cut the grass, but like still the pool is abandoned. There's a lot of like green water in the pool, like that's sitting for the whole season, and given mosquitoes, right? It's a threat to public health. And I explained to him about the citations and all that, and he became very aggressive. He have thrown all the F-bombs he can. Then he threatened me with his dogs, and like, a number of F-bombs he have thrown me, I have not heard it before in my life, So I came off the property. I did have to call the police, PD to report that, and I did bring it to our manager's attention that this has happened. So I just want to bring it to the board, We definitely probably need the happiness garden in the town, That's what I will say. I was pretty rattled, when I came to the department, given like his own kids are at the property, and given what's going on with the with the mosquito-borne diseases, right? And in 2019 we saw a AAA case here in this town. I was shocked, with the behavior of the individual there. So, but I just wanted to bring it to the board, that how still, given going through the pandemic, public health is treated so bad, like or the officials, it's just. I don't know. I don't have too many words, So, but I just wanted to bring it to the board, that this happened today. We did issue a beaver permit at the Shore Road that was causing some flooding issues in the area and affecting properties that was mitigated by the Central Mosquito Control Program. So we did issue a beaver permit to our DPW. Spice Kitchen at 59 Pond Street is back open. Was a grocery store from time of pandemic. Now they have converted it back to a restaurant. So they are back open as a restaurant by name Spice Kitchen. Mill Pond Rest Home, I did get a pest control report finally from them August 8th. And the last conversation I had with the owner in the email exchange, they still said that they are going ahead with the change of ownership at the property, and should be happening probably this month. Chestnut Place apartment, I guess I mentioned it to the board last time. We have a $100 citation there for the trash. Serious apartment, both the new cases, there was 2 new cases I heard back from the management. They are resolved now. And 137 Pond Street, we have a court hearing on that in Worcester Court on September 5th, Thursday, that myself and the building commissioner will be attending. Just on the disease investigation part, from the last month salmonella outbreak that we have in the neighboring town, we had now 5 cases in Ashland from that outbreak. Then we have picked up one new TB case and another case of Campylobacter that we have closed. That's all I have. If any board member have any questions, I'm open.
One
Thanks,
question, Raj. Sorry
Go
you
ahead.
had to go through that today with the abandoned pool. I didn't catch the address on that, and where did you leave that?
Yeah, it's at 11 Pine Hill Road. So, and I'll definitely need board's assistance, maybe, to get the correction, given how the mosquitoes borne diseases are going, because one of the West Nile cases, right, was in Middlesex County. So I'm definitely very concerned, that we might be some activity going around us,
Yeah.
So Raj, just let us know what you need us to do once you get more information.
I will say.
Yeah. And then the next time when you go there, maybe you should take the police staff before you go alone.
Absolutely, sir. No, that I'll be very
Yeah.
mindful, you know.
Right, yeah.
Thank
I know, they should immediately recognize the public health issue. If there's mosquitoes, it's a big issue here. Yeah.
Right.
And I have one question because I was not on the board last year and the previous year, so I just want to make sure that whether this has been brought to the attention of the board. I just got a minutes, the agenda item for the school building committee. And there seems to be a mold issue that they've been considering. Has this been brought to the board any time before here or no?
No.
Should we not be concerned at all? It's a question of mold that might inflict harm to the children.
So maybe we could have, Raj, could you reach out to the superintendent? Maybe, and then just update the board by email what's going on.
I will say yes.
School
And
opens.
I believe that we have the required authority, and the statute says 111, section 122 is the one that's applicable for us to handle the mold cases.
That is
So,
correct, sir.
yeah.
It's a public health issue for sure, you know.
so that,
Yeah, so KG, maybe let's have Raj get in touch with the superintendent or the facilities director, and then he could email us, and then if we have to have a quick, emergency meeting, we can get one scheduled pretty quickly with the
Sure.
board.
at least they should at least come to us and notify us or tell the
Absolutely.
department saying there is something happening. And I'm glad that they're working on remediation, but at least we should know that we
Right.
don't want to be caught by somebody else asking, hey, you're on the board of health, what is happening to mold? So I can't say I
Right.
don't know anything. So
Absolutely. I hate, Jay, would you mind just wrapping up the meeting? I do have to get on to another meeting at 7. Our meeting, I told them I could get on at 7 because I know we usually only last about 45 minutes.
Yeah, I get it. I have it.
All right.
You can go.
Everyone, thank you. And Raj, once you speak to the school department, if you could let me know, and we can get a meeting scheduled with the
I
board.
will, sir.
Great. Good
Thank
night,
you, Ed.
everyone.
All right.
thank you. Yeah.
Yep. All right. Is there anything else for Raj? No? Okay. We can move on. I think it's the consent agenda. Yeah. Does anyone want to make a motion to accept the consent agenda, which is the draft minutes for July 2nd, and also the year-to-date budget reports?
So moved.
Okay.
Second.
Second. Okay. All in favor?
Aye.
Aye. All right. Consent agenda passes. And then we have discussion of future items and next meeting date. So it looks like we've got September 3rd and 17th proposed as next meeting dates. I mean, that works for me. Is there anyone that does not work for?
No problem for me. It works.
No problem. You're
No,
all
good
set,
here.
Dave?
Yep.
Okay. All right. So I guess we'll shoot for that, Laura. 3rd and the 17th.
Yes, sounds good.
Okay. Is there anything else that anyone has for next for future agenda items? Let's see, the tobacco regulations, is that something that is going to go around and we're going to take a look at soon?
Yes, sir. And the other thing I want to mention at this point, right, that we are also looking for another regulation, for that will be probably involved is the blight regulation. We don't have too much around, blight in town, from the regulation standpoint. So the building commissioner, I am currently looking at some paperwork on that, so I'll see if that can come on the next agenda, or at least a draft that will bring it to the board.
Okay,
Yeah,
that'll be interesting.
Do you think, Raj,
That's new to me.
that chicken coop placement, is that going to come to the board next time, you think? Are they ready for that? That
was on the Main Street one, right, sir? Correct?
right.
Yeah. So the last conversation I had with the owners was like a couple of weeks back, right? I have not heard since.
Okay.
So to get the waivers,
Sure. Maybe next time, maybe it'll come to us. Who knows?
Yes, sir.
Thank you.
Thank you.
Okay. Is there anything else, anyone? And if not, we can take a motion to adjourn.
So moved, sir.
Okay, is there a second? Nice, Dave.
Second.
Okay, all in favor?
Hi.
All
Aye.
right, excellent.
Thank you, Jay. Thank you,
It was
Dave.
easy. All right.
My
Thanks, everybody.
apologies for the technical